Key point number 2 takes a close look at the health risks associated with obesity. When we're talking about obesity in this lecture, we're referring to the over-fat person. And keep in mind, when we look at BMI and we compare those to the tables that rate, where that weight category is, that people with a background of athletics, a very strong athlete, might have a BMI that reflects obesity, yet that doesn't reflect the true body composition of being over fat. So just keep that in mind. BMI does not necessarily apply for anyone who's pregnant or athlete. The problems with overfat or obesity as related to health is we see increased mortality risk, meaning that we may die of a younger age because of that obesity. We see increased amounts of hypertension, cardiovascular disease, diabetes, gallbladder disease, post-operative complications, and some cancers. When we talk about diabetes, it's mainly type 2 diabetes we're referring to when we see an increased risk for that disease. Next up, we also see a problem with misguided dieting, that many times when someone is over fat or overweight, they make many attempts at losing weight, but a lot of times it's under the guise of some sort of extreme weight loss plan. We consider extreme anything over 2 pounds per week, not necessarily targeting a health goal, because when we lose more than 2 pounds a week, it's not possible for the body to lose more than 2 pounds of fat per week in general. So when the body's losing more than 2 pounds, it's losing typically muscle mass as well. Muscle mass we consider to be healthy, and muscle mass affects our basal metabolic rate, as we talked about in lecture 1, that our BMR goes up if we have more lean body mass or muscle mass. So it's to our disadvantage to go on an extreme diet and lose some of that muscle mass, because then our basal metabolic rate drops and the amount of calories that we're burning day in and day out comes down. So then if we return to our usual eating, it's going to be much easier for us to gain weight, in fact even more weight than we may have started at, because our BMR now is lower. So this is yo-yo dieting. When someone goes on an extreme diet, they lose lots of weight, and then they go back to regular eating and they gain weight, and they gain even more than they may have started out in the first place. And then they go on an extreme diet again and they lose the weight, and they keep repeating that cycle or pattern. Next up, we're talking about social and economic disadvantages of obesity. We also sometimes term it as weightism. There is a certain amount of prejudice in our culture against people who are obese. If we look at job opportunities, when someone goes on an interview, 2 people with equal skills, if one of those persons is obese, it's been shown through research that that person typically does get a poorer rating, even though everything else might be equal. There's a famous model that actually did a mini study on this, where she was doing some interviews and trying to get people to fill out questionnaires. And on one instance, she did it in her regular body, and then on a second instance, she put on a fat suit and just tested to see what the response was. And many more people stopped and spoke with her when she didn't have the fat suit on, picked up the pencil for her if she dropped it. People were much more receptive when she didn't have her fat suit on. So this is something for us to kind of think about. What is it like for those people who are obese, or if you're heavy yourself, you already have some feel for, gee, how is the culture maybe looking at me through different eyes. As we talk about managing our food intake, it's important to put some definitions around some terms. One of them is hunger. Hunger we define as our body's physiological response to the need for food. That one of the things that triggers a hunger feeling is when the nutrient levels in our blood start to drop down. So this might be the amount of lipoproteins or fats traveling in the bloodstream decrease, or the glucose in our blood starts to drop down, and we have a lower blood sugar. These are triggers to the brain to then send us that signal that we're hungry. It also might send a signal to the stomach to start contracting. There's lots of different factors that affect our physiological response or our hunger. Make sure you review those in your book and take a close look at how those interplay with each other. Second, we'll talk about appetite. And appetite is more of the psychological desire to eat. When we choose to eat, even though our body isn't physically needing food. Again, different things make a difference in whether we feel appetite for something or not. Learned preferences or timings. Many of us might eat on a certain schedule. Some of this is a physiological response, but there's also a psychological response that, hey, if I normally sit down, when I'm sitting at the TV, I usually have food in my hand. Sometimes we'll sit down at the TV, and whether our body is hungry or not, we'll have an appetite to go grab a bag of chips because maybe our body is trained to have food at that time. That's our psychological desire to eat. Again, read about this in the textbook and go a little further with it than I am talking about it here. Get a good feel for the differences between hunger and appetite. Satiety is another term to define, and it means that perception of fullness. When we actually have that feeling that we're satisfied and we don't need to put any more food into our body. Certain foods can increase the amount of satiety we feel after a meal. Foods that are high in fiber, high in protein. We also know that fat-rich foods will slow down digestion. If you remember when we talked about fat digestion, that fat really kind of floats at the top of the stomach and it's last to be digested in a meal. So when we do have a little bit of fat in our meal, it tends to give us more of a satisfied feeling. When we talk about helping people with controlling their food intakes, one strategy is to make sure we include a little bit of protein, a little bit of fat, along with the carbohydrate in each meal or snack that we have to help improve satiety. It tends to work better as far as blood sugar control and also weight management and our ability to just feel good about what we've had to eat. Glycemic index of foods can affect satiety and also the water content of foods. This is one of the reasons that a whole fruit might make us feel more satisfied than drinking a cup of juice. That whole fruit is high in fiber. It's also high in water content. Those things give us a more full, stretched feeling in our stomach, which satisfies us. Check in your book for some of the theories of obesity. Some of those theories have to do with things inside the body, and some of those theories have to do with things outside of the body. One of the things that you want to make sure you understand is what some of the external cues are involved with. So timing, sight, or smell. We also consider actually most of the theories that I have on this slide here, eating foods to satisfy a certain emotional need. We consider that an external cue that, gee, I'm bored, I'm going to go stare and see what's in the refrigerator and maybe have a box of crackers because that gets rid of my boredom. We call that our external cue to eating. Take a look at these theories in your textbook and read them more at length. There's lots of theories that they have of obesity from a physiological standpoint that are growing and developing daily in scientific research. Some of you may have heard of something called gastric bypass. This is a surgical procedure where they limit the size of the stomach, and the way that they do this is the physician would actually take the size of the stomach down to about 1/4 of a cup and bypass. So they kind of staple up or sew up the rest of the stomach, and they clip off some of the small intestine, and they move that up and connect it with that top 1/4 cup of the stomach. That's why they call it gastric bypass. They're going to bypass a big portion of the stomach and a small amount of the small intestine. With this, the person's unable to eat very much. They're also unable to absorb as many nutrients. That's the object of gastric bypass because they're helping that person lose weight. This is indicated for people who have certain parameters around either how large they are or what their other medical conditions are. So some parameters that might indicate that someone's appropriate for gastric bypass would be someone having cardiovascular disease, type 2 diabetes, or sleep apnea. Sleep apnea is when someone stops breathing during the middle of the night or anytime they're sleeping, and this is many times brought on by that added weight that sits on top of the diaphragm and presses down. They don't have the strength to continue to take a breath, so they stop breathing momentarily during the night. Also, anyone who is obese with any of three of the following on this slide, like hypertension, high LDLs, you can read through those on your own. So those would also be a compounding factor that might indicate the appropriateness of gastric bypass surgery. But I want to stress that gastric bypass surgery is not something to take lightly. It's a huge lifestyle change for someone. And take a look at what they talk about in the textbook, but understand also that it's a serious decision for someone to make. Desirable body weight. How do we define that? We really need to look at overall health parameters, and that's the direction you'll hear me go in this class. And from my perspective, all I really would be interested in is someone looking to improve their health. We're not talking about getting ultra thin for a runway model, type of goal, although I suppose some of these strategies could cross over and help someone in that type of profession manage their weight. We want to look at listening to hunger cues, and I'll post something in the extras area called a hunger rating scale. And it's my philosophy that if we all would tune back into our true physiological hunger and eat according to that, not try to deprive ourselves outside of that, eat according to that, with of course some nutritious choices, then we would pretty well maintain a good body weight. But a lot of us do not listen to those cues anymore. We ignore them, and we try to deny ourselves too far, and too far of an extent, which then sometimes backfires and turns into a problem where we really don't know when we should be eating for hunger or when it's kind of excessive. Also, looking at healthy diet as the focus and physical activity. So making sure the right healthy habits are in place. Keeping track of blood cholesterol, triglycerides, blood glucose levels, and blood pressure levels to make sure those are appropriate. Tracking inches versus weight. Inches are probably the most effective way to know how you're doing as far as weight loss or weight management, how our clothes fit. From a health perspective, we feel that inches have a lot more to do with health than maybe what the scale might tell us. Percent body fat as well would be a wonderful tool, although not everyone has access to it. That's why I would say maybe using the way your clothes fit might be better. We also need to consider looking at what is the comfortable weight for each individual, because having an appropriate achievable goal is key. Some persons might be motivated to do extraordinary levels of activity to maintain their weight at a very low level, whereas someone else of that same height and body type might not have that high of a priority on having a very low body weight. So it's appropriate to have a goal that might be 10 or 15 pounds higher. We're still looking for good health, but also doable goals. If we make it an unachievable goal, then it's very unlikely that we're going to be able to maintain or manage our body weight well. Size acceptance might also be part of the work that we do with someone for desirable, coming up with weight goals. Many clients will come in and they might say to me, gee, I want to be 105 pounds. And as I do my interviewing and learning about them, one common question I ask is, when was the last time you weighed that? Or how long of a period of time did you weigh that for? And many times the answer is either when I got married or when I graduated high school. There's no problem with that. It doesn't mean they can't be that weight again. But those times in their life, they might have been at a different place with different priorities. So they really need to kind of rethink what is the right size for them at this